Good evening and welcome. My name is Hubert Faustmann. I'm the director of the German Friedrich Ebert Stiftung or Foundation, a think and do tank affiliated with the Social Democratic Party of Germany. We have an office here in Cyprus. And I'd like to welcome you to tonight's event entitled A Systemic Analysis of the Impact of the COVID-19 Pandemic on Refugees, Migrants and Asylum Seekers in Cyprus. And a part one of a research of a project of our partner whom I would like to welcome to this live stream. It's the project Phoenix with the director Hrishabh Sandilya, whom we see on the screen here. When they approached me a couple of months ago with the idea to conduct research on the situation of migrants, asylum seekers and refugees in Cyprus and the impact the COVID pandemic would have on them, I was very enthusiastic to embrace that project and jointly conduct it. Be accurate, the research and most of the findings, or the findings are really the work of the Phoenix project, and we are supportive and co-partners in this project. Maybe a few general remarks. COVID-19 has hit all of us hard to various degrees, but there's some more vulnerable than others. Usually in the public discourse, these are the elderly and those with medical conditions that expose them to a higher risk of negative side effects of the COVID pandemic, who are often overlooked. Amongst the vulnerable groups are the refugees, the migrants and the asylum seekers. And we are focusing here on their fate in Cyprus, but I think they're a very good case study for the fate of those people in other parts of the world as well, since some things might be in parallel. And so without any further ado, I would like first to give the word to Hrishabh after welcoming also those who follow us on Facebook. There are some invited speakers here in the Zoom group, but those of you out there on Facebook, please type your questions in and there will be an opportunity. Norman will take your questions and will pass it on to the panelists before in this last part of the session, we have a larger panel discussion with the people here in the Zoom meeting. So that's it from my side. Hrishabh, the floor is yours.
Thank you, Hubert. I'm going to quickly share my screen. I just want to make sure everyone can see that. I'm going to quickly introduce Project Phoenix and why we decided to go ahead and do this research project and its importance before I hand over to my colleague Sarah, who will actually talk about our findings from part one. So Project Phoenix is a hybrid NGO and social enterprise. We're young. We were set up last year and we launched in Cyprus in the fall of last year. Our goal is the systemic change of the migrant inclusion ecosystem, using socially innovative approaches premised on systems thinking and taking a strong understanding of sustainability into our logic and the way we function. Our work is basically done or executed through three different pillars, namely a fellowship program, innovative partnerships, and advocacy and narrative change. Talking a little bit more about our fellowship program, we work and empower talented migrants and refugees in Cyprus to help them become entrepreneurs, or when they can't become entrepreneurs, we help them through professional and skills development. You might have heard about Afro-G, which is our first big fellows project. Letitia's project was launched over the summer, and she's running an African-inspired clothing range. Our second pillar of work focuses on innovative partnerships with existing organizations and NGOs like Caritas, and I believe some of our partners from Caritas are here, and Zero Food Waste Cyprus, where we use technology and creative approaches to partner other organizations to further the process of migrant inclusion. To quickly give you an example, we're currently working with Caritas on running an online English language class where we have professors in India providing language education and online learning to refugees based in Larnaca and Nicosia. And our third pillar is an advocacy and narrative change pillar, where we use solutions-based trans-disciplinary research to lobby for change and work with policymakers to come up with policy around the things we work on. So in this case, we were talking about the COVID impact research project here. So very quickly to go into why exactly we decided to proceed with this research project and why there was a burning need. This project was honestly born out of a conversation I had with Sofia Papastavrou, who's his advisor at Project Phoenix and a well-known gender expert in Cyprus. And we were talking about the differing experiences of the pandemic and how people and groups on the margins were going to experience this much differently. let's be very honest. This pandemic, has, as Hubert mentioned, has had a terrible impact on everyone's lives, and I think we're all struggling. And I think we're all going to struggle even more as we, get into the throes of the sort of second and third waves of lockdowns. And we also, it's logical to assume that this has had a worse impact on the lives of people on the margins. But, it's important to back this up with evidence, with data, and I think this was our driving call here, to see what the impacts were, understand them, and back it up with research and data. We did this to sort of understand essentially what and how systemic faults that already exist in the system have been exacerbated due to the pandemic. So I don't think, at least this is my assumption, and I'm pretty sure that I don't think there's been any excessive change in policies, especially in Cyprus, because of the pandemic. I think what the pandemic has really done is it's towards migrants. I think what the pandemic has done is made things worse and sort of, accentuated already existing faults. And it's important to understand what these faults were. Like Hubert said, people on the margins don't necessarily have the voices necessarily that they need to. They have voices, but they're not amplified. And with migrants particularly, they have a voice, but they're not a vocal minority. And I think it's important to give them that platform. And I think through our research, we're actually doing that. And finally, and perhaps most importantly, the whole idea with this research project, and this is a 3-phase research project. What we're presenting today is an overview, and Kyriaki will talk a little bit about the survey. But the goal here is to come out with a white paper where we use the findings from the research project, the overview and the survey, to come up with a solutions-based white paper at the end that will be useful for policy in Cyprus and beyond. And I think before we begin and I hand over to Sarah, it's also important to acknowledge the limitations of our approach and the way we've done this. Part one is, almost entirely based on sort of secondhand research, secondhand knowledge. We've been talking to other people and, of course, some personal observations. We're hoping to build on, to get to the goal of a consummate white paper. We're hoping to build on part one and part two, have discussions like this with other, organizations and other experts out there, and use, what we find out in these discussions at these events, and also build extensively on the survey findings to come up with a strong white paper. I'm going to hand over now to my colleague Sarah. Sarah is a researcher at Project Phoenix. She is also a global law scholar at Georgetown University. And Sarah did most of the writing on part one. So I'm happy to hand over to her to provide us more context on the findings in part one.
Thanks so much, Hrishabh. If you don't mind letting me share my screen. Okay. All right. Can everyone see my screen? Okay, wonderful. Okay, so again, thank you so much, Hrishabh, for some of that background information, and thank you all for joining us today. So just to give a little bit about the background and methodology for this project. For part one, we looked mostly at publicly available news, academic, and social media sources. So in addition to that, we conducted interviews with caseworkers at humanitarian organizations, experts in the field, and refugees, migrants, and asylum seekers. And just for ease, I'm going to shorten refugees, migrants, and asylum seekers to RMAs. So we also reviewed the legal decrees and the mandates that were put out by the government in regards to the pandemic. So for those who might not be aware, here's just kind of a brief timeline of the events that happened around COVID-19 in Cyprus. So we noticed the first documented case happened on March 9th of 2020. And then shortly thereafter, the first restrictions on movements were mandated by the government. And by the end of March, there was a full-on lockdown with an overnight curfew. And then on April 8th, the government issued a lockdown decree under the Quarantine Act. And then about a month or so later, we saw a gradual easing of lockdown restrictions. But now, as many know, the pandemic is worsening around the world, and including in Cyprus. And so we are now seeing, again, more lockdowns and more restrictions. So one of the first things we noticed when starting to do our research for this project was the difficulties that a lot of RMAs had accessing information on COVID-19 and the related government mandates. So from the very beginning, it was very difficult for RMAs to get any sort of clear information on the pandemic. And this was also due to the kind of ever-changing circumstances around the pandemic. But in general, there was a pretty haphazard nature in the messaging coming from the government. Most of the messages were coming from television or government websites, and often these websites were pretty difficult to navigate. In addition to that, there were language barriers. So initially, the government translated these mandates in English, Greek, or Turkish, and not necessarily in languages that many RMAs in Cyprus speak or are more familiar with. So this resulted in a lot of RMAs kind of being unaware of these mandates or, unable to comprehend them. So the government also had informational hotlines, but many RMAs were unable to use them, and there were even cited incidents of RMAs trying to call hotline operators, but being unable to communicate with them. We also saw here, local and international organizations kind of stepping in to fill in the gaps. So the Cyprus Refugee Council, UNHCR, the Dignity Center, Caritas, and others worked hard early on to translate some of the advisories and the postings, and they were able to share those on their social media websites and other messaging applications that were more easily accessible to RMAs. And as time went on, there was improvement in communications coming from the government. They started to translate in more languages, and they were sharing informational posters throughout different communities. But there still is an information gap that exists, and it's something that, again, we're kind of concerned about now that we're starting to see, the reemergence of the lockdowns. We worry that there's still a lack of information out there. So then next we looked at the impact of movement restrictions and the lockdown on RMAs. And so for those who might not know, at the end of March, the government mandated a requirement limiting people to going outside only once per day. And this also included an SMS message that you had to send to obtain permission to leave your house. This was controlled and overseen by police and government officers who were checking IDs and the validity of these messages. So a lot of RMAs found these rules to be pretty complicated. They were initially only published in English and Greek. So there were many who were found to be in breach of these rules, and some were even fined. So in urban areas, the situation looked quite different than for those who are living in detention centers. In urban areas in particular, there was difficulties accessing essential services, getting to work, and just in general navigating daily life. And as I mentioned before, these SMS requirements left a lot of RMAs in a difficult position of, fearing leaving their house for to get arrested or to be fined, but they still at the same time needed to leave to go get those essential items. So there were also, multiple accounts that we heard through our interviews, and we've also heard from other organizations on the ground of RMAs being fined for unknowingly violating these mandates. So another case that we heard about happening in urban areas were police rounding up RMAs that were living on the streets or that were being sheltered in churches and mosques in the Old Town, and they moved them to Punara camp. So the government justified this on health grounds, claiming that the conditions that they were living in were unsanitary and cramped and could lead to the increased spread of the virus. But at the same time, the Punara camp is arguably just as cramped and unsanitary, and just as likely a place to have a big COVID spread. So that takes me to the detention centers. So in early April, the government mandated that no one could enter or leave reception or detention centers with the exception of new arrivals or humanitarian or medical aid workers. And even before the pandemic, these centers were generally overcrowded. So this really left, no space for any sort of social distancing. There were limited resources for sanitation and a lack of washing facilities, which led to hygiene concerns, not only for the spread of COVID, but for the spread of other diseases as well. And around the height of the restrictions in May, we saw around 700 people in Pornara camp, which is a number that far exceeds its design. A few other issues that we saw were housing of minors alongside adults, and then following complaints of sexual harassment in those cases. There was also a scabies outbreak, which kind of shows the extent of the unsanitary conditions there. So there was advocacy that was done by local organizations, and they helped to push for the removal of the immunocompromised or vulnerable people in the centers. And so after this pressure, the asylum service started to allow people to leave, but only if they could present a valid address, which is difficult for many RMAs. So as of the end of September, Pornara still remains a closed facility, but there were around 265 individuals in the camp. So next, we looked at the access to healthcare. So for RMAs, even prior to COVID, there were quite a few systemic barriers to accessing healthcare. So for most asylum seekers, they have to seek treatment in public, inpatient, or outpatient departments, and there's often difficulty booking appointments and long wait times. So with this, we saw a lot of difficulty accessing COVID-19 tests. Initially, most RMAs pretty much had no access unless they were new arrivals who were entering a camp, or they had symptoms, or were found through contact tracing. Later on, private labs started to offer tests, so anyone had the option of paying for these tests, but initially they cost 110 euros. That was later reduced to 85 euros, but these high costs were a huge barrier to RMAs accessing any sort of testing. So of course, and this is something that we've seen, across the world, is that access to regular healthcare and medical treatment was limited during the lockdowns. So this, of course, impacted people who had other underlying health or chronic conditions. So for many RMAs, the only option was to call health centers or doctors on the phone. And language barrier became a huge issue here because it required the intervention of a local organization to translate the calls. And while this helped, there were still issues with privacy and miscommunication issues. And so this led some to decide to kind of ignore or push off seeking medical care. So we also saw pretty significant mental health impacts. There were studies that showed that 1 in 4 adults in Cyprus experienced pretty high stress levels during the lockdown, and that a majority of them said that their life had changed significantly. And we believe that RMAs had similar experiences, if not exacerbated by some of their increased vulnerabilities. But NGOs did help to kind of step in and address some of these issues by providing counseling. The Cyprus Refugee Council in particular used online video conferencing and social media to help provide counseling and spread awareness on different mental health issues and provide tips to deal with stress. So then next, we looked at the impact on the asylum and migration procedures. From around March through June, most of the government offices were closed to the public. So RMAs had more or less no access to migration offices, lawyers, or any sort of asylum procedures. So new arrivals could not lodge new asylum applications, and they were instead transferred to the Pornara camp and held there. For the asylum applications that had already had their interviews, they continued to be processed. There were also some national and appellate courts that continued to receive legal aid applications and appeals, but otherwise all other proceedings were suspended with the exception of a few urgent cases. So again, we saw local organizations trying to fill in the gaps and providing legal support to those in the community, as well as those detained, using different communication platforms. So the situation since then has improved, but these temporary closures just increased waiting time, and some RMAs in Cyprus wait years to receive a decision about their asylum applications. On average, an asylum decision takes between 36 and 60 months. So we also, of course, looked at the impacts on the economy and on labor, and there was a pretty significant loss of jobs and livelihoods, and a lot of RMAs had difficulty re-entering the labor market after the lockdown. So many RMAs, were employed in the tourism sector or in catering or accommodation. And a lot of these companies and businesses faced long-term closure of these establishments. And so many lost their jobs. And even prior to COVID, many were already dealing with pretty difficult financial situations. And this is due to some of the deeper and more systemic issues, like just limited access to the labor market in general, a lack of skills or education, and a lack of social capital. But at the same time, there were RMAs who worked in essential services and were able to remain employed, those who worked at supermarkets or in the health sector. But they also found themselves working quite stressful hours, and they had difficulty maintaining social distancing guidelines. We also saw here difficulties accessing banks. So many RMAs do not bank online, and so they need to go in person. And they faced long lines, as well as issues dealing with different crowding limitations. And so, this resulted in them struggling to withdraw funds and execute rent payments. We also noticed delays in social benefits. So the government offices conducted their work solely over the phone and email, which led to quite a bit of frustration and confusion for RMAs who were without work and who were pretty heavily reliant on these social benefits. There were reported delays from March through May 2020. And as of the end of September, the situation had improved, but there were still RMAs that we interviewed that were saying that they're experiencing pretty dire financial situations, and that they were still experiencing some delays in receiving their welfare and housing benefits. So the government did release a few aid packages to help keep businesses afloat and ensure employment. And while this was beneficial to RMAs who were in regular employment, for most RMAs who work either regularly or they're in temporary employment, they were unable to benefit from these packages. So then next we looked at some of the impacts on education. So in Cyprus, the law guarantees access to primary and secondary education for RMAs. But for adults, only those recognized refugees with international or temporary protection status can seek a public education for like personal development and skills training. But these classes are only offered in Greek and Turkish. So for those who don't speak Greek or Turkish or who don't have this status, they either have to pay for private education or make use of free opportunities that are offered by NGOs. So many organizations have kind of stepped in here to provide this education, but you know, these education providers have had to cancel in-person classes, and this has left many without access to education. But, you know, a lot are turning to, you know, online learning or in-person learning environments with fewer students and increased social distancing. You know, in particular, Project Phoenix did a collaboration with Caritas Cyprus where they had survival English language classes online, and those have been pretty successful. So next, we were sure to include the gendered impacts, and we really conducted this research and also the next part of our research, the survey, through kind of a gender sensitive lens, understanding that, you know, this is, you know, important to be able to offer really effective recommendations for some of the specific impacts that women face. So, you know, around the world, we've seen the pandemic exacerbate these existing inequalities between men and women. We also noted an increased threat of gender-based violence. The lockdown measures led to increased confinement, you know, in spaces with abusers. And according to a report by UN Women, the domestic violence helplines in Cyprus registered an increase in calls by around 30%. So there were also increased pressures to take on domestic and child rearing responsibilities. There was less access to contraception and sexual and reproductive health care. And there were added pressures and stresses that also impacted mental health significantly. So in our research, we did kind of a brief overview of the situation in the north. So we noticed too that the first case happened around the same time on the 9th of March as it did in the Republic of Cyprus. They faced you know, lockdowns as well and social distancing mandates, and in certain areas with higher cases there were pretty strict lockdowns. You know, and in general though, the impact on RMAs, just for some context, so the TRNC does not operate their own asylum process, and the protections that you find in the Republic of Cyprus are not available to RMAs in the north. So, you know, there was the incident that happened in March 2020 of a boat carrying asylum seekers that eventually capsized, and they were rescued by the TRNC. They kept them in indefinite detention, and then eventually sent them back to Turkey, where they now unfortunately face a risk of refoulement to Syria. Then looking at some of the impacts on foreign workers and students in the north, we've seen that politicians have kind of been using this pandemic to make foreign workers and students political targets. You know, there were you know, government officials were quoted saying that the pandemic was a good excuse to clean them out. But many of these workers and students were unable to return to their countries of origin. And under the lockdown, they had difficulties getting food and basic supplies, but there were civil society organizations that helped to step in and fill in some of these gaps. The situation there has since improved, but there, again, are concerns about this winter and the rise in cases and, you know, ensuing lockdowns. So in general, I think one of the big takeaways from part one of this project is that there's been a noticeable deterioration in quality of life for RMAs And while some of these, mandates, have, been intended to curb the spread of the virus, they've kind of instead exacerbated and marginalized RMAs and put them at increased risk of harm. So, we're hoping that given the way that, COVID has already dramatically changed the way we see the world and we think about things, we hope that this can be an opportunity to address some of the deeper and underlying issues that RMAs face in the country, and hope that it's an opportunity to kind of change some of the migration systems to offer them, adequate protection and to uphold their dignity.
Thank you so much, Sarah, for your presentation of part one. Just a short piece of information. The first part was published as a report both on the websites of Project Phoenix and of the Ebert Foundation. We also produced a podcast with Sarah and Hrishabh, which is available as of today on both of our websites. So please visit them, listen to them, read the first part of the report. So the idea now was to open up to those of you who are listening and watching us via Facebook in case you have any questions or comments. Now would be a fantastic time to articulate them. We'll have about 15 minutes for that before we go into the final part and the final panel. Norman, our intern, any comments, any reactions on social media so far, any questions that could be addressed to the speakers so far?
So far there are no comments, but thank you all for the presentations, and I keep you updated if there are some comments.
Okay, if there's nothing on social media, I don't know, Hrishabh, if you want to go straight into the panel discussion or if you want to open it up to panelists here for 15 minutes.
Let's take some on Zoom. I think there's some interesting questions. I'm sure there'll be some.
Exactly, I'm sure there is, so that would be also my suggestion. So I open the floors. Please, it's a limited number, just unmute yourself if you have a question or comment. Anybody who wants to make a contribution has some questions. Silence is golden, but usually if you wait long enough, the psychological pressure and pain is too big to bear and somebody asks something. So let's just...
I think we have Anna Grace. I think Anna Grace wants to go.
There's the weakest link. Please.
I think Nico's also raised his hand. I don't mind if you want to go first, Nico.
Okay with you if you want to go first. Go first.
Ladies first. Ladies first.
I just wanted to ask Kyriaki, just before I didn't catch it. How many people already participated in the survey in total?
$71.
71. All right.
Nico.
Yes. No. It's the overall. It's a very important study, and I think it empirically provides fascinating and certainly disturbing results, but not surprising given the context. I'm wondering if you can tell us more about the profile of the person you were interviewing or you are interviewing. We saw the very disturbing results of people working in the slaughterhouses, which have been closed in Cyprus, which is just an illustration of this. And we had seen this with the Zorpas, people at the bakeries. We have seen this in the case of the people working in supermarkets. And I won't be surprised to find in the delivery places in all the areas where they are tested, because there's an issue there about how much tests there are. So I'm wondering if you can tell us a little bit more about the kind of people you are interviewing. I mean, the sort of jobs people are doing or were doing in the context of the study. That's my first question. I don't know if you want to go for that, and then we can go for more questions.
I think I'm going to just quickly give you an overview of how this process was run. So for the part one, we interviewed about 5 or 6 caseworkers and experts, and some are on the panel right now. And these are people who are working with the refugees and migrants. And then we spoke to another 3 or 4 refugees and migrants to get basic confirmation of the facts. And they weren't detailed interviews, they were short one-hour interviews. Now the plan with the surveys is that we're hoping to run about 200 surveys in total, between 150 and 200. We're about halfway there. As you can see, we've gotten a lot of response from the West African community, and we know this is not statistically representative of the breakdown of the actual populations of refugees and migrants in Cyprus. So we're hoping to expand to get more responses from the Arab-speaking world and also from other
parts. Is there a reason for this? Why is there this disparity? Why is there such a positive response by the African community as opposed to other communities?
I think there's two reasons. One is our own limitation, because we've been working right now with English and French-speaking staff, and we ourselves have been going out. We don't have enough Arabic-speaking, surveyors with us, and the whole plan now in the next coming weeks is to find people who can speak Arabic and go into these communities and sort of push them to respond. I also think in some ways it's a reflection of the mentality. In some ways, I think the West Africans are more happy to share their stories or be sort of open to sharing. Whereas the few Syrian responses we've got, we really had to sort of push and request them to it's a question of both. But I think the limitation is more on our end. We haven't been able to reach out to them as we'd like to. And the plan is to really push on that. And just to finish up, so the plan is once we finish the 150 to 200 surveys, hopefully we get there, we plan to do at least 10 to 15 detailed in-person interviews. And so we haven't really gotten to that because we wanted to first find out, finish the surveys, have our basic preliminary findings and then do the confirmation process, the sort of triangulation process through the detailed interviews. And exactly what you say, I think that's what we're going to be trying to reach out, the specific different groups, the instances you've mentioned. That's something we're hoping to keep in mind as we go forward.
Good. This is a very, very important findings. The other issue I have is I read the report. I had a chance to look at the report, and I think it's an important report with which gives an overview. I'm wondering whether you are being a little bit too nice, because you try to, in the sense that there are really, really shocking things happening out there from our reports and our studies in terms of violence. I've confirmed, and I spoke to people who have told me about police violence and police abuse. I've been told of examples of people going on a day who were demonstrating on a daily basis outside the labor offices, and I've been told of all sorts of really. I mean, so what we have seen there with your survey, with the racism by others, particularly, is a major issue. But also, I've heard a lot of reports. I haven't been able to kind of do a survey, but so many incidents of basically being closing their face of officers, of public officers, where they went for applications, refusals, and being really nasty things coming out. I'm wondering if you have heard about this, or it's have been reported, or whether you hope you could also look at the nasty side of things, which have to be reported. That's one side. And I want to also to go to the flip side of that, which is the kind of solidarity events and more positive mobilizations that we have seen recently, which was a remarkable positive thing, and hopefully optimistic, although the government is very negative about them. So if you have any of that to be recorded, perhaps in your white paper or in your research finding, because these are also important parts of the study that would give a better picture of what is going out there.
Sarah, did you want to take the first bit about stuff that we possibly potentially missed?
Yeah, so I mean, I guess just a little bit of background and kind of some of the decisions, I guess, that we've made. We were hoping to try to be, I guess, just objective in our research and in our work. But I mean, there were some things that I think, we were hoping to be able to try to frame in a way to be able to provide constructive feedback and recommendations at the end of the day. So I think that's kind of our mentality going into it. And I don't know if Hrishabh, you want to expand upon that a little bit.
Sure. I think honestly that Sarah started working on this paper sometime at the end of June, early July. So this report itself was written over 3 months, and a lot changed. And the sections that you refer to, certain incidents were things that were written in the past, and then these sort of events occurred, and we didn't update the previous section. So that is on us, and that is our fault. And there have been certain things that we have missed. Honestly, we've also missed a lot of things because we've had limitations in the way the research has been done. We focus a lot on English language media. We of course have Kyriaki, he speaks Greek and has also helped with the research there. But we've missed incidents there. And then some of the other things you pointed out were about bringing out the particular things about the sort of the offices shutting down, and those are things we actually heard about and we've had conversations about. And those specific things we want to bring out in the survey and the findings there, and sort of supplement the survey findings with the particular incidents. And those more recent incidents in the last two months or so we've been aware of, we are following. And yes, of course, I think we do refer to some of the positive mobilizations in our report as well towards the end. So especially in the TRNC, there was a lot of positive mobilization, and I know Samuel will probably talk about that as well, where Voice got involved and delivered food. But we also were part of different, groups and initiatives that were, giving out food, and the solidarity we saw was quite amazing in the spring. Hopefully, we'll see some of that going forward in the next sort of lockdown wave.
Kyriaki, you wanna add something?
My colleagues have covered me, but yes, I'm doing the first phase of the collection. I mean, mainly because it was an online questionnaire. And I mean, personally, I've seen that by approaching people and tell them that we're conducting a survey to see how RMAs view, have experienced this pandemic. I mean, many of them were even reluctant to even anonymously fill in the survey. Some of them, of course, especially women from the Filipino community, they were more open and said, the most important thing is how the employers manage us. They deprive us of very basic human rights, and they've witnessed an increase during the lockdown. But in general, I mean, we try to encourage people to participate in the survey and ensure they're complete, that everything would be anonymous, and so that they would be more comfortable in completing the survey. But we hope that with the main findings of the online survey, we will go with more structured, the more specific questions to do face-to-face interviews, to get more deeper to the things that Mr. Nikos Tremiklimiotis has mentioned before, and actually have a clearer picture of the everyday difficult experiences that the RMAs are facing in Cyprus at the moment.
Okay, thank you. There's one question or comment by Samuel, and then there's one Facebook question, and then I suggest we close this round, and if at the end is there further time for Facebook and questions from the panel, we complete it there. But Samuel, you're next, and then it goes to Norman for Facebook.
Right, thank you. Thank you guys so much for your presentations. I actually had two questions, but you sort of answered the first one. I was going to ask if you're going, in terms of your research approach, if you're going to take a specific focus at specific groups, seeing as the groups you've already gotten the responses from were skewed, and that's already been answered. But I just had a quick question that I wanted to add as well. I wanted to know if someone could please tell me if you have an idea of what the total RMA population of the RMA community is now, and how representative your question is going to be of that, if you understand what I mean. Because from what Hrishabh said, you're looking at about 150 to 200. So I just wanted to ask how representative that sample is of the general body. Because I think ultimately that's going to help structure how you're going to approach specific groups to make sure that you get as representative a sample as you can.
Okay, who wants to answer that?
I think Nico should answer that. Perhaps the best, most accurate figures there in terms of, or Anna Grace, someone who has a more recent.
Well, I don't remember the final figures. I mean, I don't know, Doro, you do have figures there of the people of what we are, where we're at now. We had the report that, but don't forget that we have not been in the reports that we do for the updates we do on the migration bulletin. We have a migration bulletin which we do for the Fundamental Rights Agency. The data that we are given, it goes. The last data they gave us was from May. So I think we are really behind in terms of the actual data and the actual application. I need to look at my report to tell you where we're at, but I think we can get you back so that we can talk to you about the different groups and where we're at the different times. But as I said, my data is very outdated in terms of the numbers. I know they have to provide the data to Eurostat a month afterwards, but somehow they haven't been very good at that anymore. I mean, they've been very negative in actually giving us data on this in terms of the numbers that we have. One concern about the accuracy of the sample is how many. We need to know how many people refuse to answer, how many applications, how many we send out, and how many we receive, because that's also an issue to the extent to which they feel that they answer the data. So for representative purposes, we need to know that. And the second thing is that bear in mind that in all the interviews that I've done over the years, I have discovered that when you ask people in the beginning whether they've experienced discrimination, they start by saying generally no. And then once you talk to them about specific things, they tell you tons of incidents and they admit that they have been discriminated. So I am concerned whether the survey data, there would be a denial in the surveys and underestimation of the kind of discrimination people face at different levels. Because in the interviews, but I don't know, the vast majority of the interviews start by saying, no, I haven't faced discrimination. When you ask them specifically, what about this, what about that, what about this, they come out with all sorts of stories that say, yes, actually, yes. So not because they don't know, but because I get the impression that they want to be nice to people. They want to be positive. They don't want to be, and that's the way they conduct themselves, most of the people, unless they really faced a very negative, sometimes violent, racist incident. That's the impression I have, and I'm wondering, perhaps in the fact that you will have also interviews that would remedy any possible underestimation of problems, and that's a possible thing to guard against.
All right, thank you so much. Thank you for that.
Okay, Norman, there's a Facebook question.
Yeah, there is a Facebook question by the user Safari, and the user is asking, how have unaccompanied minors been affected by this? Is there a unique struggle for their situation?
So the fate of minors, anybody has information on this? Kyriaki, do you know anything from your research?
I'm sorry, the question was about how non-adults fared during the pandemic.
Minors.
Yeah, no, we didn't exactly investigate that because we wanted to make sure that we could have people's consent to participate in the surveys, and to also answer to Mr. Nikos about the amount, the number of people that they refused to participate in the survey. So during the first phase of the project, and given the relaxation of the measures, we tried to go face-to-face to encourage people to participate. So we didn't send out the questionnaire en masse. But I assume that this will have to do given the current restrictions at the moment. But we don't have an absolute number of the rejections that we received by migrants. It was an oral rejection.
Okay, there's one more question from the group, but then I think we close this section. Elizabeth Cassinis, you have a question. Please, can you repeat it so that those who listen to us can hear your question?
Or hi, everybody. I was just curious about the source of information that you were looking at during the pandemic. You had separated out social media sources from NGOs, and I was wondering how much of an overlap there was, and if, what were the other social media, what was different about social media if not coming from the NGOs? Was that in WhatsApp groups exchanged between migrants or closed groups? Thank you.
I'm sure, yeah, the idea was, yeah, I mean, social media was essentially considered to be mostly WhatsApp and their internal messaging and, information they were receiving from their countries. But there's also definitely overlap with the information coming from NGOs via Facebook and Instagram and these kinds of So that's not a very clear distinction there.
But yes, I'd like to say that there is an overlap between at least the four first categories, which is social media, NGOs, news websites, and governments, because the type of question was that the participant was able to choose the kind of sources that they were using. So one person that was mainly using social media and come across, of course, some NGOs that they were pushing out translations and so on. They could also get some more information in direct WhatsApp messages that they were again receiving by NGOs. So there's definitely an overlap between the two.
Okay. Yep.
Before
Sorry.
we go, hi Hubert. I just wanted to add a couple of points regarding the minors question. We have seen a deterioration in the living conditions, we had an issues with schools and the limited capacity to attend to the due to familiarization and infrastructures. There was, of course, the situation in Purnara in the camp due to lack of appropriate measures to protect minors and the overcrowding and accessing their needs online. I just wanted to mention those parts as a little bit of a headlines on some of the issues that minors face during this period.
Okay, thank you so much for the addition. I think we can close. Did I interrupt anybody? I think we can.
I was going to say that, that there is a concern about minors. There has been also a report by the children, the Commissioner for Children on the subject. There has been, in this period, we have seen a denial by the minister of the fact that there have been children in Purnara in detention. There's been a widespread denial, and we have a discrediting of the ombudswoman who backed the minister when there have been when there is proof about children in detention who have been, in fact, there were incidents, as you know, there have been specific incidents reported in Parliament about the detention of children and with sexual and they have been sexually harassed and sexual incidents against them. So I think there is an issue there. There are important aspects to do with the children's rights, or particularly migrant children, and how they are treated. And the fact that there is a denial that there are in detention and there are issues is itself a finding that I think has to be investigated properly. I don't know if it's in the ambit of your methodology, but I think it's an issue that may well come up, especially in the interviews with families, mothers with children, and that sort of thing that is happening now. Even at this moment, there is an issue in the way in which the new measures have been announced. They have announced measures to close down and deny access in the case of Kofino, and I heard that there have been incidents there of not for children, but that there have been COVID-19 incidents there, and that may justify, because I'm not sure what they do. But for Purnara, there is no justification for closing Purnara for people to leave, because it is already sectioned. There is a quarantine section and a section which is not quarantine. So people should be allowed to leave because they're not. Otherwise, there will be an overcrowding and exposing them to danger. And coming into the issue of children in Purnara, that's a major concern, because there isn't a real facility there to facilitate this aspect. So I think there is something there to be investigated.
Okay, I want to close the discussion part so far since we're running late, but I hope there's time for those who still have questions and comments to make it at the end, and hand over for the panel discussion on multiple perspectives on ameliorating the impact of the COVID-19 pandemic on those of the margins in Cyprus. Hrishabh, who chair this? You introduce the panelists.
Thank you, Hubert. I'm going to quickly skip my introduction since we're running behind time and go straight into conversation with our three interesting panelists. The whole idea with the second part was, of course, to do this event live, and then broaden this a little bit beyond just refugees and migrants, but also talk about other other groups on the margins. We're going to begin with Rajiv Viranji, who is a philosopher, also doing his PhD in the United States on philosophy, and is the founder of our publishing partner, the Justice Project, which is a local Cypriot collective of active citizens, and they run a very interesting website. And they bring out some very interesting stories. I strongly advise you to look at that. Rajiv is going to now begin and sort of frame our discussion, provide a sort of ethical and moral perspective on why we should be so bothered and why we should care about those on the margins in a pandemic situation. And I think this is particularly important given that we are going into lockdown number 2 and we are in the midst of pandemic fatigue, right? And this is even more important that there are people out there who need our support. And so over to you, Rajiv. Thanks.
Hello. Can everyone hear me? Hello. So thank you for the invitation. As Hrishabh said, I'm part of the Justice Project, and we work on sort of amplifying folks' voices who are on the margins here in Cyprus. So we're very interested in this sort of thing. But I'm also interested in philosophy, and I work on ethics, and I work on ethics. And so Hrishabh invited me to sort of say something about some of the sort of philosophical topics that might arise in thinking about these like day-to-day hardcore problems in society. And I I will preface this by saying that I won't be able to do that very well in like 5 or 10 minutes. So I will try to say something to hopefully get a conversation going, and then folks are welcome to sort of share their reactions or add to these thoughts as we go along. So as I said, I'm interested in ethics, and I'm interested in both contemporary and ancient ethics. And so someone I spend a lot of time with is Aristotle. And Aristotle has this interesting insight about human beings. Aristotle observes that human beings are unique among animals in the following respect. Human beings get to, in a sense, decide or influence how they see the world, or what it is that they see in the world. So to illustrate Aristotle's point, imagine you're walking into a house and you see, let's say, chairs and desks and, I don't know, furniture and a TV and whatever, right? These are things that you see in a house. If you are a new mother, for instance, that's not all that you see in entering a house. If you're a new mother, what you see when you see tables and chairs and furniture and whatever are sharp corners. You see possibilities for your child to be injured. So being a mother shapes how you see the world. Likewise, if I give you, say, a tablecloth, you would likely see a piece of cloth that you might put on a table. But suppose you're, I don't know, Christian Dior or something like this, some fashion designer. What you see in seeing the tablecloth is not just a piece of cloth. You see a potential garment. You see a potential skirt, a potential shirt, a potential coat. You see all these things now. And so why was Aristotle interested in this feature of human beings? The fact that human beings see the world, somehow influence how they see the world by their, I don't know, by their identities or something like this. Well, Aristotle was interested in this because he noticed that depending on how you see the world, you see opportunities for action. So if you're a mother and you walk into a house and see all these sharp corners, you see an opportunity to intervene and do something so that your child doesn't go and hit their head on like a sharp corner. You want to baby-proof the house. Or if you're a designer, you see a tablecloth, you now start thinking, oh, like I can make a shirt out of this, and then you engage in the world in that way. So Aristotle was interested in the way in which the way that we see the world determines what we do in it. But he was also interested in this feature of human perception, as it is sometimes put, because he noticed that this makes us susceptible to like have really bad ways to see the world. We can become blind to things that we should not be blind to. So suppose again you're the mother and you walk into a house that's full of sharp corners. And you fail to see that situation as threatening to your child. You fail to see that situation for what it is in that case. Well, bad things happen, right? Your child comes into the house now, and she knocks her head on a sharp corner. You go to the hospital. It's a bad story. And Aristotle was super interested in this idea, the idea that human beings can be led to do all kinds of badness by failing to see the world in ways that they should. Why am I bringing this up? Why is this sort of, I'm beginning this conversation? Well, because I think if you take Aristotle's insight seriously, you have the diagnosis of our moment, of a political moment in the here and now. So to give an example, like we know that, as a few folks mentioned earlier, that children in our migrant camps are getting sexually harassed, right? We know that migrants and refugees, all kinds of folks are being detained with no reason in our migrant camps. We know that our political institutions are corrupt to the bone. Like these are things that we see. It's not like this is news to us. These are things that we know. And yet you don't see people on the streets in the ways that one would expect people to be in the streets, were they to see their government engaging in these forms of hardcore injustice. You have state-sanctioned sexual harassment of minors. You have state-sanctioned indefinite detainment. You have state-sanctioned persecutions of artists, mentioning the artist that is being prosecuted right now by the state for creating art that folks thought was blasphemous. How does Aristotle come in? Well, Aristotle helps us, I think, diagnose what is going on, or offers a diagnosis, which we may or may not find plausible. But it is, I think, a diagnosis that's definitely worth thinking about. For Aristotle, what is off in our political moment is not that we're ill-informed or that we don't see what is going on in the world. We do see what's going on in the world. We know what is going on in the world. It's just that for whatever reason, we're not seeing things for what they are. We're failing to see these things that are happening around us as the injustices that they are, as the serious injustices that we sort of live in. And so what, one might wonder, so what, once, well, if Aristotle's sort of diagnosis is right, then in a way you might find it sort of hopeful. You might think that if Aristotle is right in his diagnosis of what's going on in our political moment, if what is going on is indeed a failure to see the world for what it is, then like the mother who fails to see the sharp corners for what they are, there's an opportunity to learn, right? The mother can learn how to see the sharp corners for what they are, and so that can fix and so she can protect her child from that. Likewise, one hopes we could learn to see these injustices for what they are. We could learn to see, the sexual harassment of minors for what it is, as something that should get us en masse to the streets. And then the question then becomes, how do we do that? How do we get people to see these things for what they are? That's the question, I think, that Aristotle helps us raise. How do we get people to see these things for what they are? And so I put the question as an invitation for reflection here, more generally in our public discourse. But Yeah, so I'll pause there. I'll pause there. I'm hopeful that was somehow like intelligible. Hrishabh, I think you are muted.
Apologies, I am muted. Thanks, Raji, for framing that within what's going on right now in Cyprus in the sort of bigger perspective of the sort of plethora of injustices within Cyprus right now, but also like, what we can do and what we have to do. What is our call to action? And on that note, I'm going to move over to Anna Grace, who's joining us from the Cyprus Refugee Council. Anna Grace is a integration advisor with the Cyprus Refugee Council, and a lot of her work focuses on labor market integration and inclusion. And I hope Anna Grace is going to reflect a little bit on where we're going right now. We're in the wave, and we're in the next wave, and what comes next, and what can we learn from wave one, and what to expect.
Thanks, Hrishabh. Thanks everyone for being here. I think it's an important discussion we're having today, and I would like to thank the Friedrich Ebert Stiftung Cyprus and Project Phoenix for this invitation. The COVID-19 pandemic has had an unprecedented impact on the whole world. It has not only been a crisis of our health system, locally and globally, but also a crisis of our social system. With the pandemic hitting us unexpectedly, governments all over the world had to react rapidly to respond to the ongoing developments. In most cases, our social mechanisms, despite some efforts, failed to support, protect, and provide for everyone. I think this is something that we've seen everywhere in the world. Refugees, asylum seekers, and migrants, already being some of the most vulnerable groups in our society, were left once more in the margins. The pandemic and the measures taken to combat its spread multiplied. We've seen that it multiplied the difficulties of the populations in accessing these vital services. At the Cyprus Refugee Council, just to give a little bit of an overview of what we do and who we are, we focus on refugees, asylum seekers, detainees, trafficking victims, and survivors of torture, striving to safeguard, support, and advocate for their rights in Cyprus and promoting their effective integration in the whole society. During these difficult times, we have been doing our utmost to continue to support our beneficiaries by providing services and vital information while complying, of course, with the governmental protocols, which send most of us, especially during the first round, working from home. Thus, we adapted the mode in which we operate and shifted to providing all our services via telephone, video calls, as well as through utilizing the opportunities of remote communication that social networking platforms offer. At the same time, we remained in daily communication with governmental departments and other relevant services to provide accurate information and mediate between our beneficiaries and the services. Just to give you an overview, during the past 8 months, we continue to provide legal advice and assistance on all stages of the asylum procedures in Cyprus, including cases in detention or at risk of detention. Our legal team has also been monitoring the developments and measures taken on asylum and immigration relevant to the pandemic and intervened where necessary. We have been providing social advice, information, and assistance on social welfare benefits, labor office services, GMI, healthcare, as well as regarding the special support measures introduced by the government, as well as guidance to our beneficiaries for accessing vital services and conducting basic processes, for example, with the Department of Labor, Social Security, social welfare services at banks, etc. And all that, as well as addressing disruptions in work, allocation of benefits, and access to health services. We are in daily communication with refugees and refugee employees and employers on issues that arise due to the pandemic, while at the same time continue to promote the employability of refugees through our Help Refugees work platform. We have been in communication with governmental services, other NGOs, a lot of you are here today, local authorities, private entities for the preparation and provision of food packages and material support to people in need, We have been in communication with healthcare providers, for example, personal doctors, with the general hospital, as well as through to the hotline, the 1420 number, in order to facilitate access and communication of our beneficiaries with the help of cultural mediators and interpreters. Of course, we have been also, we have a team of psychologists who are constantly available to provide emergency interventions, as well as individual counseling with the help of interpreters again. Creating support material and self-help techniques aimed at managing and reducing stress. We have been conducting virtual workshops with beneficiaries on topics of interest, and mediating with relevant government and non-governmental services. Last but not least, I think it's, Sarah mentioned it, we have been we put a lot of effort in providing regular up-to-date information to the population through our website, social media pages, as well as through a direct SMS service, translated in Arabic, French, Somali, Sorani, and English. Those were mainly on developments of the pandemic and the relevant guidelines, ways to protect ourselves based on the governmental announcements, as well as the World Health Organization guidelines, and the relevant measures taken to combat the spread of the virus, as well as developments on asylum and migration in Cyprus and the rest of Europe. In our experience during these past 8 months, the pandemic has increased the difficulties of accessing asylum procedures and vital services such as healthcare and social welfare, while there has been a rapid deterioration in the reception and living condition of refugees. At the same time, the effects of the lockdown on economic activity have put a large number of people at even more vulnerable position. Our organization, together with other civil society organizations, local authorities, groups, have worked tirelessly to advocate and facilitate access in services, information, and material support for RMAs. While the spread of the pandemic was, as I said, unexpected and was unprecedented, we are not doubting that. These first 6 months gave us all a period to adapt to a new normality, see the gaps in the various systems and how it has impacted different groups within our society. Refugees, and particularly asylum seekers, have paid a heavy toll in regards to the enjoyment of basic human rights during this period. Having entered now a second phase, with continuous increase in cases, new measures introduced on a weekly basis to restrict the spread, we are entering a new phase today, actually. The possibility of a lockdown looming, and with no idea how long this phase will last, we have to act faster and more inclusively in our planning and response mechanisms. So Hrishabh asked me to basically talk about what can be done to ameliorate the impact. So some recommendations for filling in the gaps and ameliorating the impact of the pandemic on RMAs can be to ensure the rule of law regarding access to a fair and timely asylum procedures and reception conditions is enforced. Ensure that accurate information regarding COVID-19, the measures and decrees issued are available in a timely manner and in multiple languages. Provide access to adequate and inclusive health services for all, especially for asylum seekers and other vulnerable third country nationals who are currently excluded from RESI provisions, while addressing communication barriers by including services of interpreters, cultural mediators, to assist the professionals. Provide timely material support and facilitate access to housing and vulnerable groups. Enhance financial support to organizations, local authorities, and communities who provide support to RMAs and are in need of extended staff and infrastructure capacity. And finally, increase the dissemination of accurate information in regards to third country nationals in order to reduce the xenophobic and biased narratives that we have been seeing increased in the press in the past months. I think that's a sort of a few headlines of what can be done. Of course, we are always available to provide more information and more detailed suggestions under these topics. Thank you.
Thank you, Anna Grace, for a summary of CYRC's activities, and of course, opening up ideas going forward. What's important and how to deal with what's going to come. Now, moving over, our final speaker, Samuel Laconi, is from Voice. Voice, if you don't know, is Voices of International Students. It's the leading international student organization in the North. They've done some amazing work. They even released a documentary that I had a chance to watch. And we're really happy to partner with Voice. They've been a very solid partner. And hopefully we'll be able to also help us with executing some of the surveys so we can be a little more reflective of the situation there going forward as well. Over to you, Samuel. Thanks.
Yes, thank you, Hrishabh. Good evening, everyone, once again. Basically, what I'm going to tell you about in the brief time I do have is just a brief overview of some of the more observable impacts that COVID had on the international student community here in the North. But then, based off also what everyone else has said, now because we recently had a surge in cases of some sort, it's still pretty contained at this point. But, it stands to reason that we might expect more restrictions coming to light in the future. So going to a second phase, what is there to expect? Fortunately and unfortunately, a lot of the impacts that we've experienced as the international community here pretty much mirrors what your research has found with RMAs in the South as well. So, we found that, except for one little caveat, I would say, is that a lot of our impacts are also as externally motivated as they are internal, because as international students in a foreign country, the majority of our body, as it were, depend on remittances from back home. So as the impact on them here is not just due to the domestic COVID situation here right now, but also what's happening in their country of origin, because most of them, especially for the ones that are minors, and the majority of students here aren't even working, so still that's a very important part of their economic well-being. So there being lockdowns in everywhere else pretty much impacts their lives here. So that's, I would say, apart from that important caveat, pretty much everything mirrors what you've already alluded to. We have had physical and material impacts, like I said, apart from the economic situation elsewhere. Even those students that were here that were part of the local labor force are primarily employed in restaurants, casinos, resorts, all of which till now remain mostly closed. So their employment there has, or their continued employment there has been problematic. And then, like you also alluded to, so I'm going to keep referring to what you said. But then we've also had less material impact and more mental and psychological, because especially during the periods of intense lockdown, the actual lockdown period, we were receiving reports. Our mental health committee at the time actually really had to step up and start collaborating with local psychologists and psychiatrists where necessary, and partnering them up with students, because, being young and being stuck at home in a foreign country where you have very limited contact with anyone else, it's not just about, going outside, but the contact, the social aspect of it was important. So having all that going on, we really had to step up in that regard. But then also, there was a partnership of sorts between ourselves and other local CSOs, like Hrishabh mentioned earlier, where we tried to help with the more material and, easier, I would say, aspect of it. So we had 8 packages going out. And if I'm not mistaken, we did probably somewhere in the neighborhood of 2,000, 2,500 as a collaborative effort. Although later on, the local authorities did try to step in, but that's something I'd rather not get into. And then, but another thing that I would like to say that did happen that I personally was surprised by was the capacity of the universities here to also step up, because where we fell short, the universities really typically picked up the slack. The major universities, to the best of my knowledge, all continued feeding for the 3-4 month period. They were constantly feeding students to stay on campus, and they had like collection centers set up for students outside campus to come in. So that was pretty helpful at the time. Hrishabh did tell me to make sure that I introduce the gender perspective into my report. So I'm going to turn to that now since I'm almost out of time. The one thing, and I'm sure everyone else can attest to this because I'm sure it's pretty much the same situation everywhere, but like Sarah said earlier, the increased confinement was very problematic from a domestic violence standpoint, because that was one thing that became a recurring problem for us. We kept getting reports of young women, because now and it's not even just violence from their partners, but there was even a more unique and interesting case of a local Cypriot student who was actually being assaulted by her brother in her own home. So, there was just a general increase of domestic violence as a result of proximity. Having people locked in a tight space for an extended period of time, tensions begin to flare. So I would say that that's the one aspect that, and then to combat that specifically, one thing that we did try to take a more, I would say, actionable standpoint that we did try to adopt was we tried to work with local CSOs to set up a specific domestic violence helpline. And why this was unique is that because we tried to integrate a multilingual capacity into it. So it wasn't just going to serve people that called in Turkish, but now, you could get referred to someone who spoke English or Arabic, whatever it was. We just tried to broaden the reach as well, because we did realize that this was a problem that was becoming more worrying than anything else. But now that we're looking at part 2 of the pandemic, the position that we're trying to adopt, because, preparation is better than anything else, is whereby we're expecting the second phase to be less impactful mentally, because now, we have the experience of the first round, so people will be more comfortable to a certain degree, a limited degree, but a certain degree nonetheless. They will be more comfortable and adaptable to a lockdown in the event that we do get that far. But unfortunately as well, the more immediate material downsides will be more difficult this time, because, the economy is just now recovering, or had just begun to recover from the first phase, not just here and elsewhere. Like I said, the domestic situations in other countries are very significant for our community here. So now that more countries are going into their second phase of lockdowns, we can expect there to be a pretty negative impact on this end. And, unfortunately, there's really no way to prepare for that, because we can't tell how bad it's going to get until we actually get there. But, the benefit of experience now is that because of our efforts during the first phase, I'm personally hopeful that at least we'll be able to react more quickly in the event that we need to. Apart from that, oh, sorry, I mentioned the helpline already. Sorry, I was looking at my notes. But yeah, that's pretty much all I have to say from this end. Thank you.
Thank you. I must apologize. I forgot to introduce Samuel. Samuel has just defended his PhD, or is about to just defend his PhD in Famagusta. He's an international student. He's been in the North for quite a long time, from Nigeria, I believe, and very, very grateful for your opinion, Samuel. And of course, hopefully we can now take this into a Q&A to sort of reflect off this part and also come back to some unanswered questions from the previous Q&A. I know Hubert had something to say here.
I just wanted to announce that we have one more Facebook question, and Doris also wanted to add to the numbers. I don't know if you want to do this now or if you want to go into the Q&A with your panel. Maybe then, since you brought me in, let's just throw in the Facebook question, get the contribution of Doris, and then hand it back to you for the discussion within the panel, and maybe other questions pop up in the meantime on Facebook, and I'll let you know about it. So Norman, what's the Facebook question?
Yeah, actually we got 1.5 Facebook questions. Actually, Nozer asked, what do you think are the actual reasons that those possible participants of the survey were so reluctant to take part? So why did possible participants refuse to take part? And the other question was, it wasn't that clear, but I just tried to interpret it. It's like we are in this scientific bubble right now. Like as we talk, we are all from the scientific area. How is it possible to raise awareness for this issue, which is really important outside these scientific bubbles? So I reckon that hopefully that's the right interpretation. Thank you.
I'll go on with the first one. So at first, once personally I was approaching the people and telling them about the survey, yes, they would be reluctant, some of them, to fill. Of course, this wasn't the majority of the people, but I mean, these have been incidences during the data collection period. The main reason, I think they were afraid that their identity would be revealed, and that somehow the fact that they did this, it would end up in the hands of their employer or to the authorities. So, I mean, even a person that had no papers in Limassol, they were very reluctant in the beginning to fill the questionnaire. But the moment that we've ensured them that this is completely anonymous and that no one, I mean, I wouldn't even ask them their name at the time to ensure that we had complete privacy in terms of the data that they were providing us. For the second question, I apologize, I didn't understand what it was and if it was about me.
No, I reckon it was more in general to all participants. So, yeah, how to promote these findings to the public, to the whole public, not just to the scientific.
I think we're doing that. This is case in point proven, right? We've gone from closed rooms to being online to Facebook to being as publicly, as able to disseminate publicly as we can. I think we've gone away from talking in scientific lingo and sort of make this a sort of open discussion, bring in other perspectives, and hopefully more people will watch and try and understand how this impacts their lives, but also impacts the lives of those around them. And it also ties in some ways to Rajiv's point about what you need to do to activate and what you need to do to take responsibility around you.
Okay, Doris, are you still with us? You wanted to add information on the numbers of RMAs.
Actually, I was not sure what was the question of Nikos. This is why I asked what was about the question. I understand it's about unaccompanied minors. This was the question, Nikos.
Somebody raised a question about unaccompanied minors, and I was trying to respond to that. It's a major issue about unaccompanied minors and how they're treated by the Republic, which is...
Well, we have, in my opinion, we have some issues there, but first of all, it's the first time that we have families locked in Burnara. And to be honest, the reaction of the Child Commissioner is also a bit, although until now we are more or less very happy with the reaction of the Child Commissioner, but this time my feeling was that the statement was more satisfactory from the point of view that the children will be detained together with their parents in a separated area of the detention, and not so much for their immediate release, which is very, is concerning. It's a completely different approach than the one we were having until now. And of course, the other issue that I must say that is very difficult is because there is no transparency of what's going on between the NGO authorized by the authorities to deal with unaccompanied minors, their cooperation with the authorities and the legal guardian. So there is no transparency. There is nearly closed shop, and we have no idea what's going on with the unaccompanied minors. It's another problematic situation, in my opinion. I don't know how we can and how other NGOs see this, but it's another difficult situation for us. Well, if I could say one or two other issues from my experience, I don't know how we solve the problem, but I have the feeling that there is they are not very happy migrants and refugees to participate in this kind of surveys. I don't know what is the reason about this, but I can say that eventually they feel that we are not part of this society. Nobody bothers about us. Why do you all of a sudden you want to know what we want, how we feel in this society or whatever? I mean, I have the feeling that there are specific migrants and refugees that you can approach them through NGOs or personal contacts, that they are already aware and they are positive because they know this landscape. Otherwise, the vast majority, they will not respond to this kind of surveys. This is an issue that we experienced also in the past, especially with online, and especially when it's in any language other than their own mother language. This is my experience, so it's very difficult. The second, I agree with Nikos that from my experience and our experience, the findings are a bit behind the harsh reality we have over these few months since the pandemic in the country. And I don't know, perhaps qualitative interviews can solve this problem. But I do agree that we have a very much more and of course it has to do also with the hostility that we have a very hostile environment. Migrants and refugees are completely even we are afraid of what's going to happen in the future. You can imagine what's going on with with migrants and refugees. So they are not. They try to survive by showing solidarity with each other. It's exhausting. We have violence among migrants and refugees, very harsh confrontations because solidarity cannot solve the problems anymore. And the commitments they took between each other to support each other. But anyway, and I have also a question because today, since Anna Gris is here, I would like to know if the announcement today about corruption in relation to translation and payment of mediators is in relation to the report of Milonas yesterday he made to the Justice Minister, or is it a coincidence? Because I read today and I'm a bit worried. We follow very closely this situation, the criminalization that is carried out by the authorities right now. I would like to know. Sorry about I would like to know if this announcement today on the website of the Refugee Association, the council, is related to the accusations of Milonas against NGOs yesterday. Thank you.
Hi, Doro. We put such announcements regularly on our social media and websites because occasionally they come to our attention. There are people who sometimes pose as community mediators in a sense. They offer their services to bring people in contact with us and other NGOs, and they ask money for it. So every once in a while we post such announcements on our website, reassuring people that our services are free, 100% completely free, including the work of our translators, people who work with us. And if anybody asks them for money, then they're not working for us. So this is something that we, as I said, I think we posted a similar announcement a few months ago, and we do that regularly. As you probably know, you have come across such cases as well. I'm sure other colleagues here from other organizations have seen the same thing. So in order to avoid such situations and people becoming victimized in that sense, we try to inform people, in every way possible. So social media, website, messages, and so on.
Thanks. I also just want to quickly respond to Doris about, thank you for your feedback. We're going to keep that in mind as we go forward. But just about the survey as we're running it. So right now, so far, we've actually done very few online. I'd say 90% of the surveys we've conducted have actually been done in person. And to overcome some of the some of the bias or some of the fear, we're actually working with our Phoenix fellows. So right now we have two of our fellows who've helped us with the service. These are refugees and migrants themselves. We've provided them with the device, and they've been going around and talking to people in their native language. The survey itself is available in, Kiyaki, correct me here, in 7 languages. And we've tried to cover the most languages spoken by the refugee migrant groups in Cyprus. So in some ways, we've tried to cover those sort of easy sort of low-hanging fruit in terms of biases and limitations. But you're right, some of the deeper issues that are there, and I mean, honestly, I don't think they share. The fact of the matter is that the ones who do share, the ones who are willing to talk, are the ones who are comfortable talking to NGOs, the ones who are, you know, within the NGO world. But the ones who are truly experiencing the worst of it do not share and are too scared and are too out of it. So this is a limitation, and hopefully we can cover this and have a few more frank conversations in the interview period going forward. We have about 10 minutes left. We have an interesting discussion that's still sort of unfinished off the last panel. And I guess we're talking about solutions as we go forward. We still have people with a lot of experience on the ground here. Doros, Nikos, Elizabeth, I believe, has left. But it'd be interesting to get your viewpoints in terms of, like, as we go forward into lockdown number 2, what are some of the easy wins here that we can do to prevent some of the worst of what we saw in the past months? Practical solutions going forward, both for NGOs but also for the government.
Can I come in on this?
Sure.
The first thing, I've looked at the figures, the latest figures that I have, and this is relevant to answer your question. We're told by the announcement by the asylum service that between July to September 2020, there were only 1,532 new applications for international protection, and the 1,600 were told that there were 1,600 for first-time applications. 53% of whom were Syrians. And we know that there are a few, and I can tell you some more details in terms of who they are. This is from the latest report from the top nationalities were Syria, India, Bangladesh, Nepal, Congo, Cameroon, Egypt, Nigeria, Pakistan, Georgia, and Vietnam, in that order. What I'm trying to say here is that in terms of the numbers, what the discourse was before the pandemic was that we can't cope, we're flooded, and it's an issue, and really you have to help us. We have the larger per capita number and all that. So this is no longer the case. Okay? We have a situation where the numbers do not justify the discourse, the anti-asylum discourse. So this is a situation that we have to go out and let people know. I think this is very important because it has nothing to do with the realities that they were painting last year and the year before, that the numbers are high, and they've been going around Europe and the EU trying to get money and support for this. So I think this is something we have to hammer in, trying to press them for the figures. You can press them too, and see what happens. And in my report that I'm going to do of an update of my report, this is going to come out quite strongly. The second thing is that we have a situation where we know that the people who have not benefited from the solidarity measures that were announced are always at the bottom scale and for the frontline workers. The frontline workers and people who work in the informal sector. Your survey has shown this very, very strongly, closely. If we want to avoid a situation and a major public health issue and mass poverty and these sort of things, they have to realize that they need to change the way the solidarity and support measures are distributed. So this is something we have to bring it back to. We already know that those who are penalized legally and socially for having to go out and work and break the pandemic curfew and to move were actually informal workers, mostly migrant workers who are working informally. Now the informal sector is massive in Cyprus, and I think this is something that the shock that was somehow uttered about what was going on in the slaughterhouse is hypocritical. This is a migration state of exception that has been benefiting Cypriot society since the beginning when it first arrived when the law changed in 1990. So since 1990, we have a system which is based on this twofold thing: exploitation, super exploitation of migrants which allowed the expansion of the so-called Cypriot miracle, economic miracle, to continue. This is shown by studies of the University of Cyprus that show this between 1995 and 2005. This has gone on in a big time with the informal sectors, who are also victimized and considered to be public enemy number one in the media discourse. If we want to change that, we need to kind of start from now. What we had in this period, instead of solidarity for the people who have suffered most, we saw a major witch hunt policy, which was done by most of the political parties, the media, and that sort of thing, directed by the government itself. And I think that's why I'm very critical, because I don't know how you guys are going to conduct a policy to speak to Mr. Nouris. I don't know how you will speak to people who are themselves responsible for what has been going on. We have seen 3 new things that have been happening here, which would never happen before. Openly admitting that they were doing pushbacks in the sea and pushbacks on land. This is a violation of international law, of an outrageous thing that's going on. We had 6 reported cases so far, and they are doing it, and they have normalized this. Secondly, we had a situation where they are invoking states of exception on hygiene issues in the most horrific way. You mentioned the escapees. This is completely incredible of what is going on now in that situation, and unleashing this negative attitude in society. This has to also be opposed directly, not by being, we can't be nice about these things. We have to say, look, enough is enough. We will not tolerate this. And the third thing, which I think is a positive thing, is that in reaction to this unleashing of all these racist forces in society, there has been a strong response by many people, younger people, people who are willing to bring things. I mean, but this is going on informally. Informally, people are pushing and doing things. So the informality of exploitation is met by the informal acts of solidarity, and we need to coordinate actions all together and realize that we have to find a way of coordinating and working together against a very negative situation. So if we're going to learn something, we really need to push for normalization, and I'm talking about legalization of migrants. We need to push for in the direction that I'm talking about what Portugal did, for instance, and that's a way forward. I'm talking about the allowing for benefits, of all sorts of benefits for people who work in the informal sector, and I'm talking about the ways in which we should be taking action to ensure inspection of the people at their workplace. And I'm talking about involving NGOs in inspection processes, not the police, not negative, but NGOs, groups that are working together. So perhaps these are some pointers about what to do in the future if we are going to have something and learn something from the current situation. Because if they want the economy to function, if they want food to be delivered in their homes, if they want people to go and pick up their the agriculture, if they want to have meat in their plate, they need these workers, and they are migrant workers.
Thank you for that. Very interesting points there, and really help us in some ways moving towards the white paper in terms of coming up with positive ways to move forward. And Rajiv, and you've been part of this. You were part of organizing a large wave of protests and talking about the civil society solidarity. And any sort of concluding thoughts from you?
Well, there's I guess a lot to say. One thing to say maybe is that I said earlier that I'm optimistic about getting people to sort of see the injustices for what they are, I guess calling for their engagement. And I think to that end, like doing things like protesting is really good. And it is a shame that we don't have a we don't have a protesting culture, I don't think, here in Cyprus. I mean, you see protests in the north, well, at least on this side of the border. You see folks in the north by the thousands outside, and what are we doing here? And over this side, and I think that's a problem. Mobilizing folks and getting them to the streets is, I think, a way to publicly declare that this is something to be outraged over. Whatever it is that you're protesting over. And so I think that would be a good thing to start doing, like getting people on the streets en masse. That would be good.
Okay, I think I'm going to hand it over to Hubert. We're almost out of time for final concluding thoughts.
Well, thank you, Hrishabh, for Mediterranean standards. We're absolutely amazing. It's 7 o'clock. Thank you for 2 wonderful hours. 2 hours can be a very long time on the internet. I think for internet standards, we made it a short time. So first of all, thank you to all of the panelists for your contribution. So a super big thank you to the Phoenix Project, who really deserves the glory and the praise for the project they're doing and for the work that continues to be done. And we will follow that up with further events. A big thank you for all of you out there who've been listening to us, and to those of you who have not listened to us but will listen to us once it's out on Facebook and our websites, which, if I understand correctly, might be actually very shortly, even immediately after the meeting. As far as I know, Facebook will have the recording on the Facebook page, and then we make sure we disseminate it through our websites. So a big thank you to all. A wonderful evening. Stay safe. Good night.